Hi guys, this is Ohio Nursing Home Abuse and Neglect lawyer Will Eadie at Eadie Hill Trial Lawyers, here to tell you the 6 most important wandering risks for dementia and Alzheimer's nursing home residents for you to know about to help prevent wandering or elopement injuries. This is part of our Healthy in a Nursing Home series, where we take what we learn as nursing home abuse and neglect lawyers, what nursing homes do wrong, how that leads to injuries and death, and try to explain it and give preventative strategies to encourage family members to support the healthcare team in preventing injuries or death of nursing home residents. Our hope is if even one person watches the video, prevents an injury or death who would have otherwise called us and now they don't need to, then that is worth all the time and energy we put into this. So without further ado, what do I mean when I say wandering? Well, when you have cognitive limitations, Alzheimer's, dementia, lack of safety awareness, not oriented to where you are, when you are, things like that, that can lead to a situation where you leave a nursing home or assisted living facility. You might be agitated and just get up and start walking, walk out the door and keep going. You might think to yourself that you are going home or to meet somebody for holidays, things like that. Whatever the innocence of the thought behind it, if someone isn't aware of when or where they are and not able to negotiate the outside world safely, they're likely going to die if they leave a nursing home. That's what we mean by wandering. In legal and medical legal terminology, they call that elopement. Not really something you'd normally talk about, but basically getting up and wandering out of the facility. And we see all kinds of ways that this leads to injuries and death if they're not recovered almost immediately. That can be exposure to frostbite, freezing to death, things like that. That can be exposure to heat, dehydration, and overheating and death. That can be not realizing the dangerous situation you're in, walking into water or falling into a lake, drowning in a pool, getting on railroad tracks and just following those because it's a nice clear path without realizing a train's approaching or what that whistle means. So it's really a matter of life and death. Super important for nursing homes to identify these risks and prevent them. And here's how you can help out by knowing these 6 factors. Number 1 is an unfamiliar environment. There's nothing that will more immediately make someone scared, uncomfortable, agitated than being in an unfamiliar situation. When we're fully cognitively aware of where we are, why we're there, we can tell ourselves, I don't need to be nervous about this. We may not even get that nervous reaction. But when you don't have that ability and you suddenly find yourself in an unfamiliar place, that can lead to anxiety. You might want to leave and find somewhere familiar to be. So what does that mean for you? When a loved one is going to a nursing home or assisted living facility for the first time, they're being admitted or they're being readmitted from a lengthy hospital stay, something like that, that's a critical period, that 24 to 48 hours when it's truly unfamiliar, where they might spontaneously decide to try and leave the facility. The risk goes down. The longer they're there, the more familiar it becomes. So that's a critical period of time to look out for and make sure that the nursing home's looking out for it when you're not there. Number 2, medication changes. We don't realize when we're younger, we understand medication can affect you. It can affect your consciousness level. It can make you drowsy. It can make you disoriented. But we know that up front and we think we understand what those side effects will be. When we're older, elderly people in particular can be more sensitive. So they have a heightened response. They get their respiration level goes down further with opioids. Their confusion is worse, things like that with medications that can cause confusion. Besides a greater impact, it can also have an unexpected or even counterintuitive reaction. So for example, Ativan is a medication I see often prescribed and used when people are agitated. Some real problems with that, but that's for another video. If Ativan is new for somebody or it's used in a greater amount, or even sometimes if they're familiar with it, using Ativan can have the counterintuitive effect in an older person of causing more agitation, more confusion, things like that. So medication changes are a huge period of time after that change where there needs to be a lot of attention paid to that person to make sure that they don't get up, have a fall, leave the facility, things like that. Number 3, being left alone. that can be an uncomfortable situation. If someone's used to having a roommate, if they're used to seeing certain family members at certain times, if they're used to, let's say they're in the nursing home side and they have a spouse who's able to live in the assisted living or independent living side of a facility and sees them every day, and then something changes and they're left alone. That can be a dangerous situation. If staff takes someone to an unfamiliar area, say wheels them somewhere, decides they have to do something else at that moment and leaves them, abandons them, they may get up and try to walk away. So that's an important area as well. Number 4 is changes in schedule and routine. What do I mean by that? Our lives can be very formulaic, can be very much set in a routine, especially when we're in an institutional setting, assisted living, or a nursing home setting or a hospital setting. And if you're used to, for example, every day at 10 o'clock, someone comes in and takes you out to physical therapy, and then that doesn't happen that day, that may be a basis, or a different change in schedule may be a basis for getting up on your own unsafely. Number 5, being spatially disoriented to familiar cues. So as we age with dementia and Alzheimer's in particular, the idea that a door looks like a door, a window looks like a window, what an exit sign means, what a door handle means, what a lock means, what a warning sign means, all of those kinds of things can be harder to interpret, particularly if they're new. So if someone is having difficulty with spatial cues, that's something occupational therapists, for example, can help figure out, then they may be in a situation where they don't realize that this is an outside door, or they don't realize what those cues are in this new environment. A stairwell, for example, a sign on a door that says stairs ahead. Things like that can be a really important factor to be aware of if the person suffers from those types of limitations, and then address that. And number 6, demonstrates a desire for a past practice that includes getting up or leaving or being independent. So for example, someone may start talking about they want to go visit a son, or they want to go see their parents, or they want to go home, or they want to go to work, whatever it is, they start verbalizing this desire. And then you might think, or a care provider might think, well, they have dementia, they're disoriented, I'll reorient them to right now, and then problem solved. The problem is, if what they're expressing is a desire that may include getting up and leaving, then that desire needs to be addressed more than simply redirecting them in the moment, because it's a desire that may pop back up later in the day, the next day, a week later, whatever. So taking affirmative steps is really important in that situation. So those are the 6 big risk factors for folks in a nursing home setting who have Alzheimer's or dementia. That apply specifically to them in terms of the risk of wandering. If you see something like this, say something. Say it to a nurse, not just an aide, charge nurse or RN if you can, report it to the director of nursing, ask it to be reported to the primary care doctor or nurse practitioner provider. Ask for, if you don't feel like things are being addressed or there's continuing problems, ask for a care conference as soon as possible, which should include a director of nursing and administrator, and care team staff. Ask for the notes from that meeting, ask for the care plan, how they're going to address it, and stay on top of monitoring them to make sure it happens. Nurses and aides, in my experience, don't want to provide bad care. They want to provide great care. That's why they became nurses and aides. But with the chronic understaffing I see in many facilities that's outside the nurse and aide control, if you're not kind of the squeaky wheel making sure people are doing stuff like that, then they may cut corners because they have to, because they just don't have enough staff, because the corporate parent or the facility company decided they wanted to take more money out of the facility than spend it on another nurse or a few aides. So really be aggressive on that, because it's just so important. I'm Will Eadie, nursing home abuse lawyer. If you have thoughts, whether you're a care provider who wants to give some more insights, whether you're a family member has questions or comments, leave a comment. Like and share the video if you would, if you think this is important. But don't put anything confidential in the comments. If you want a confidential legal review, then you should reach out to us on our website. There's some links in the comments section below. Also some tips on and additional information on elopement and wandering. Or give us a call, 1-800-674-8163. Again, 1-800-674-8163. I hope this is helpful. I hope you check out the rest of the series. And I certainly, from Eadie Hill Trial Lawyers, wish everyone to stay safe and healthy in a nursing home. Thanks so much.